Good morning, everyone. Today, I want to share with you some stories about some patients. And those patients, let's say they come for a consultation. So, the first, and it's a new patient, you have never met the patient before. And you realize 10 or 20 minutes into the consultation, things are not going well. Patient is not happy with anything you explain to them, they're not happy with you. And the question here, what do you do? Do you just let them go? Do you charge them? Do you refund them? How do you approach that? Because I heard stories of dentists getting angry, kicking patients out, standing at the door, hey, get out of here. I don't want to ever see you again. Please walk out. How do you deal with those situations? I will explain to you some stories I've faced in the past and how, with experience, I have a system now to deal with that and how I approach as well. So, first, for credibility, my name is Khaled. I have been a dentist for 20 years and I own my own dental practice, Lakeside Dental Spa in Hervey Bay in Queensland. And I took it from 1 chair to 10 chairs, and we start with probably a team of 3 staff members, and now we're close to 40 staff members. So I'll tell you a story, and this story I'll use as an example. So let's say a patient, probably mid 50s, walked into my room, new patient, and that was probably maybe 10 years ago. Because now I see most of my patients are referred to me, so I don't. Most new patients are coming to see me and waiting to see me, so it's a bit different story. I'm talking about when I used to be like seeing a lot of regular new patients as new patient exams. She walked to my room. She had 2 crowns, some dark margins on like some metal dark margin on the gum margins. X-ray shows some PA lesions as well, so probably require some root canal treatments. She had some other individual crowns, let's say on the 4s and the 3s. She had a bit of crowding. Patients, she was asking me, I want to have some whitening done. Can you please do whitening for me? And I looked in her mouth. I did a full exam as we usually do. She has some amalgam fillings as well on the back. She has some cracked teeth. And I went through all my communication technique styles and explained to him, okay, we can do whitening, but we have 2 central eyes with some infections. We have to treat that as well. Probably the crowns has to be changed after the whitening because they're not going to change the color. And the patient will interrupt me while I'm talking, say, bullshit. And I was taken a little bit like, what do you mean? Exactly, bullshit. It's like, bullshit. My sister had whitening, she had crowns, she had no problems, she didn't have to redo the crowns. I don't think what you're saying is right. Now, most dentists in situations, they get defensive, they have very close body language, they start to get really upset. Sometimes they, that's my treatment plan, if you don't trust me, get out of here. The best way to approach that is to use one of the techniques I use called EIC. Again, example, impact, ask them to change. And you can watch my video on giving constructive feedbacks. But let's play that. So again, I said, okay, I'm a little bit confused. I told her, look, I haven't seen your sister. I don't know how her case is like. But in your case, if I do whitening, it's just simply not going to work. You have 2 crowns. So you have like a A3 like kind of like shade, so you're not gonna change the color. I want you to be aware before we do anything that's just not gonna work, and you need to treat them first. It's like bullshit. My sister had the same treatment and she never had any problems. In that situation, my advice to you, just lean back a little bit, open your body language. When you lean back, you start to relax because your heart is racing, you're getting angry. So lean back, look at the patient and just relax your shoulders, just open your body language and use the ERCs. Example, impact, as change. So I will tell my patient, look, well, you came to me and you probably paying me so I can examine your teeth and give you my opinion. But every time I'm explaining my opinion to you, you reply to me and say bullshit, which means you're basically dismissing everything I'm saying, and probably you're disrespecting everything I'm saying as well. And that put me in a position where it's really hard to give you a proper advice if you kind of dismiss and disrespect everything I'm telling you. So if you want me to be your dentist and continue to examine your teeth today and give you an advice based on what I see is right for you, how are we going to do this differently? And from there, the patient has 2 approaches. Either they start, change everything and suddenly realize that their behavior is not really great, or they will do what this patient did, which insists that no, I'm still not the right dentist for them and what I'm saying is bullshit, and they demand me to follow the plan. So I did that, and patient's like, oh no, that's really bullshit. Everything you're saying is wrong. I want my whitening, thank you very much, just tell me how much it is. I want a code so I can compare to other practices, and I need to check that, and I will get back to you. And in that situation, after doing the things properly, I'm not angry. I just lean back a bit more. Okay, you know what? It seems to me like it's not working. I don't think I'll be the right dentist for you. I can't work with you if you are gonna dismiss my advice. I can't offer you even whitening in any treatment planning because it's not the right treatment for you. So I understand you're very inconvenienced today by coming to my practice, probably spend an hour here on the chair or half an hour. I looked at your teeth and did all those x-rays, and I didn't give you the answer that you're wishing to hear. So as a token of goodwill, I'm gonna be nice to you. Probably I won't charge you for anything today. Consider it a free consultation, and if you need your records, I will send it to another dentist if for your choice. But I'm really sorry I can't meet your expectation, and I don't think I'm rather dentist for you. Nice to meet you, lovely meeting you, and I wish you all the best. But I think it's time to conclude our visit today because it's not gonna work long term. And I did that. Patient stood up, was angry, walked out, and never came back. But for me, I'd rather do that early on than trying to take this patient on. But don't get angry, don't get upset. I know it's easily said than done. Lean back, use my AIC technique, which is example, state exactly what they're doing, the impact that I can give you an advice. If you're gonna responding to me by that, it's very hard for me to take you on as a patient. Very hard for me to treat you if you're disrespecting me and disrespecting everything I'm saying and ask them to change. If they're not willing to change, dismiss them very nicely. I would offer a refund if they prepaid for the consultation, or I won't charge them. I'd rather do that than charge them $80 or $200 for the exam and clean or the exam and x-rays, and then they're not happy about it and they go and complain and ask for a refund and putting a one-star review. I'd rather buy my peace of mind and refund them for this amount and let them go rather than trying to deal with this later. My mindset is the most precious thing that I can afford at the moment, and I cannot afford to get my mind to be occupied with something as negative as that. So if you have faced something similar, share it with me. If you find this helpful, make sure you like and share it to your friends and colleagues. If you want to hear about my videos, subscribe to my channel and turn the notification on, and you'll be notified when I release more videos. Thank you so much for listening. It means a lot to me.